Welcome to our video on natural methods of contraception, barriers, and spermicides. Let's get started. Here is our overview slide. Let's begin by discussing natural methods of contraception. Natural methods of contraception are the least effective methods of preventing pregnancy, and of course, none of them protect patients against sexually transmitted diseases. The options include periodic abstinence, coitus interruptus, and lactational amenorrhea. Let's discuss each of these in more detail, starting with periodic abstinence. The method of periodic abstinence may seem straightforward. Track the menstrual cycle and avoid intercourse during the periods of ovulation. However, in order for this method to work, a woman needs to have predictable, regular menstrual cycles, which isn't always the case. Additionally, it may be challenging to correctly track the menstrual cycle without using supplementary ovulation tracking methods, such as ovulation kits. Of course, the biggest advantage of this method is that a patient would have no need for mechanical or chemical barriers, such as condoms or oral contraceptive pills. The disadvantages, however, may turn patients away from this method because it requires a lot of effort, has low reliability, and depending on the patient's menstrual cycle, may warrant prolonged periods of abstinence. Here is a figure depicting the typical course of a woman's menstrual cycle. The method of periodic abstinence relies on patients being able to track the cycle and avoid intercourse in the time period around ovulation. This is because the period of ovulation is characterized by the mature egg moving from the ovary into the fallopian tube, where it can then be fertilized by a sperm cell. In other words, the period of ovulation is the time when a woman is most fertile, which is why the goal of periodic abstinence is to avoid intercourse during this period of peak fertility. Coitus interruptus is characterized by withdrawal of the penis from the vagina prior to ejaculation. The idea here is to prevent or minimize the volume of semen that may potentially reach the female egg. Similar to periodic abstinence, the main advantage of coitus interruptus is the lack of a need for mechanical or chemical barriers. The key disadvantages, however, are that this method has low reliability and it does not prevent deposition of pre-ejaculate into the vagina. The term pre-ejaculate refers to the fluid that exits the urethra during sexual intercourse but prior to climax. Its purpose is to lubricate the urethra in anticipation of ejaculation. That being said, it may also contain sperm, which means that it is possible to achieve pregnancy from deposition of pre-ejaculate alone. Lactational amenorrhea is characterized by a temporary state of infertility during the breastfeeding period. Recall that the production of milk in the breast tissue is made possible largely by the excess amounts of prolactin released from the pituitary gland. High levels of systemic prolactin inhibit fertility because prolactin inhibits the release of GnRH from the hypothalamus. A drop in GnRH leads to a drop in FSH and LH, and no ovulation may occur without these two hormones. The advantage of this method is once again a lack of need for mechanical or chemical barriers. However, the two main disadvantages are the low reliability and the fact that this method cannot be used beyond the first 6 months postpartum. Let's re-examine this figure, focusing on the role of hormones in the menstrual cycle. Normally, the hypothalamus releases GnRH, which stimulates the anterior pituitary to release FSH and LH. FSH acts to stimulate the developing follicle to mature, whereas a surge in LH is required to trigger the process of ovulation. During breastfeeding, the levels of prolactin are very high, and, as I just mentioned, will inhibit GnRH. This will have a downstream effect of decreasing FSH and LH, which means ovulation will not happen and a pregnancy will not be possible. All right, now let's move on to the next topic, barriers and spermicides. Specifically, we'll cover the male condom, the female condom, the contraceptive diaphragm, the cervical cap, and give a general overview of spermicides. A male condom is a thin latex sheath placed over an erect penis prior to intercourse. Its purpose is to prevent the ejaculate from entering the female reproductive tract and fertilizing the ovum. The main advantages of a male condom are that it's cheap and highly effective if used properly, and it protects against sexually transmitted infections, such as HIV. The main disadvantage is that it decreases sensation during intercourse, which may be one of the reasons why male condoms tend to be used inconsistently. Here's an image of what a male condom looks like. A female condom is a soft pouch that is inserted into the vagina prior to intercourse. Just like the male condom, it prevents the ejaculate from entering the uterus and fertilizing the ovum, and it also protects patients from sexually transmitted infections. The two disadvantages are the fact that the female condom tends to be more expensive and less straightforward to use than the male condom, and again, that it also decreases sensation during intercourse. Here's an image of what a female condom looks like. Note that it has two flexible rings, one that is placed deep into the vagina and the other that stays just outside of the vagina. A contraceptive diaphragm is a dome-shaped rubber or silicone cap that covers the cervix and thus prevents entry of sperm into the uterus. It's inserted into the vagina prior to intercourse and is often used in combination with a spermicide cream, foam, or gel to increase its efficacy. The main advantage is that it's more effective than the female condom. That being said, it has a long list of disadvantages that should be considered before prescribing it. First, it requires proper fitting by an experienced clinician. It also requires replacement every 2 years at minimum, and it may no longer fit after a significant change in weight. Second, it must be left in place for at least 6 hours following intercourse, which may be uncomfortable or a hassle for the patient. Third, it may be colonized by Staph aureus and predispose patients to toxic shock syndrome, especially if it's left in place for a long period of time. Here's what a contraceptive diaphragm may look like. A cervical cap, as the name suggests, is a small cap that covers the cervix and prevents entry of sperm into the uterus. Just like the contraceptive diaphragm, it's often used in combination with spermicide cream, foam, or gel, and it requires proper fitting by an experienced clinician. The two main advantages of a cervical cap are that it may be placed up to 6 hours prior to intercourse and that it may be left in place for 1 to 2 days. The two main disadvantages are that it can be difficult for patients to place and remove the cap on their own, and that the cap frequently dislodges. For most patients, these disadvantages are the primary reason why most patients do not stick with the cervical cap after trying it out. Here's what a cervical cap can look like. Okay, moving on to spermicides. These are a collection of products designed to disrupt cell membranes of sperm cells and create a barrier to entry into the uterus. As I mentioned earlier, these may exist in the form of creams, foams, or gels, and they're often used in combination with contraceptive barriers, such as the cervical cap. The main advantage of spermicides is that they're cheap and easily available. One of the main disadvantages is that they must be placed into the vagina at least 30 minutes prior to intercourse in order to allow enough time for the spermicide to disperse in the vagina. The other disadvantage is that they're thought to increase a patient's risk of contracting sexually transmitted infections, potentially due to the vaginal irritation and small breaks in the mucosal barrier. All right, let's finish up with a question. A 25-year-old woman comes to the physician for a routine checkup with no complaints. She has a past medical history of gonorrhea, treated with ceftriaxone and azithromycin 5 years ago. She has recently learned that her new male partner is HIV positive. The physical exam is unremarkable. Her vital signs include a temperature of 37 degrees Celsius, a blood pressure of 115 over 80 millimeters of mercury, a heart rate of 90 beats per minute, and a respiratory rate of 16 breaths per minute. Which of the following contraceptive methods best protects the patient from contracting her partner's infection? A. Coitus interruptus. B. Cervical diaphragm. C. Cervical cap. Or D. Male condom. All right, this patient has just discovered that her new male partner is HIV positive. HIV is a sexually transmitted disease. From the given options, male condom is the only contraceptive method that protects the patient from contracting a sexually transmitted infection. This is because the male condom prevents direct contact between mucosal surfaces during sexual intercourse. So the correct answer is option D. Here is the slide that we covered, reminding us of the advantages and disadvantages of the male condom. Importantly, we can see that it protects against sexually transmitted infections such as HIV. All right, now let's discuss why the other options are incorrect. Option A, coitus interruptus, is when the man withdraws the penis from the vagina immediately before ejaculation. This does not protect against sexually transmitted diseases. Option B, cervical diaphragm, and option C, cervical cap, are also incorrect because they don't cover the vaginal mucosa. Therefore, a woman using either of these contraceptive methods is still at risk for contracting a sexually transmitted disease. So again, the correct answer is option D. And that concludes our lecture on natural methods of contraception, barriers, and spermicides.